Welcome to our launch of Bear in Mind, a program that we put together focusing on well-being in the workplace. At New Hampshire Businesses for Social Responsibility, we know achieving a healthy bottom line requires profitability and productivity, but most of all, it's about the people. To maintain a healthy bottom line, we must take care of our employees. And mental well-being is not only key, it's one of the most urgent needs we face today. Mental Health America's Mind the Workplace 2022 report points out that 4 in 5 employees report that workplace stress affects their relationships with friends, family, and coworkers. 56% of all surveyed employees spent time looking for a new position. With that in mind, New Hampshire Businesses for Social Responsibility connected with professionals to assemble a mental health and wellness program designed to assist our member organizations and the general businesses in New Hampshire in destigmatizing mental health and allocating resources to help employees. So I want to thank you and welcome you to this initial webinar. And I want to thank our sponsors for making this program possible, Kennebunk Savings and Coca-Cola Beverages of the Northeast. I also want to take this time to thank our partners in providing the content and expertise. We have a program that just launched today as well for stress management with Full Spectrum Wellness. We thank Rosemary Conroy for providing the artwork for the program, the Richards Group for helping us with mental health first aid training, NAMI New Hampshire, Dartmouth Health, Brown Center, and the Richards Group for providing content for our webinars. Today's speakers are very experienced and have, as I said, a wealth of knowledge on this topic. And our first speaker is Dr. Philip Adamo, who is currently the Section Chief and Medical Director of Occupational and Environmental Medicine at Dartmouth Health in Lebanon, New Hampshire. Dr. Adamo is board certified in both internal medicine and occupational medicine. He did his internal medicine residency at Berkshire Medical Center in Pittsfield, Massachusetts. He was a primary care physician in private practice until he went back to school to obtain his MPH from Medical College of Wisconsin. He then became board certified in occupational medicine and has been in various occupational medicine leadership positions since 1995, mostly focused on employee health services for large academic institutions, including Berkshire Medical Center, UMass Memorial Healthcare, and Bay State Health. Dr. Adamo's bio is extensive, so I'm going to share it in the chat as well as the bio of our speakers, and I will introduce the speakers as they come up. So I will hand it over to Dr. Adamo.
Thank you, Seema. Good morning, everyone. It's a pleasure to be here and talk about one of my favorite topics, one that I feel I have helped here at Dartmouth Hitchcock to bring to life the importance of our well-being. In case you have, so the timing is appropriate, and I don't know if it was planned, but yesterday was National Mental Health Day. Was that planned that way?
Let's say it was planned.
Okay, great. So the truth is that George Washington always told the truth and Pinocchio didn't. So I thought I would put those up there to remind us that we really need to look at this and be true to ourselves. Next slide, please.
And I did give you control if you need to.
Oh, you did? Okay, great. Let me see. Let's see. Maybe you should do that. Okay. So I think we'll start out with definitions. What is well-being, and is it different from wellness? And my past experience has been that we focused more on wellness, and at UMass Memorial, I started the first wellness program. And the focus was on keeping your body and mind healthy. However, the CDC and also our regulatory agencies have felt that there should be more of an impact on well-being, and I'll talk about what we did here at Dartmouth for that. So well-being is the experience of health, happiness, and prosperity, and it includes good mental health, high life satisfaction, and a sense of meaning or purpose. Well, how do we get there? We get there by having wellness programs that help us with our emotional health, our lifestyle health, our physical health, our social health, and let's not forget our spiritual health. Next slide, please. Okay, so let's also take the definitions of joy and happiness. And I won't go through the litany here. However, there is a difference between joy and happiness. And what is the difference? Is that it lives in the mind and the heart. So joy is of the soul, happiness is of the moment. Joy embraces peace and contentment, waiting to be discovered. Joy runs deep and overflows. You've heard this in many and read this in many poems. Joy is a practice and a behavior. It's deliberate, it's intentional. Happiness comes and goes blithely along the way. Happiness is more of, I'm happy because my daughter just had a baby. I'm happy, because I'm getting to go on vacation with my family. Those are happiness. Joy has to come from within, and joy endures hardship. And another example I'd like to give is one that's a little bit more heartfelt, is the death of a loved one, someone who lives far from their parents, isn't able to get there in time for their death. They are sad. However, the joy of knowing that they had this loved one in their lives persists. Next slide. Okay, so we're in the workplace, and I'm going to really kind of draw the picture between the behavioral health challenges and safety in the workplace. And it's not just in hospital care. Most of my work has been with healthcare workers. However, I've gone beyond that with other businesses, paper industry, regulatory jobs, DOT, and what is important here is we need to have optimized health, not just in clinicians, but in all of our workers. We must enhance high quality care and decrease the odds of costly preventable medical errors. And we have been able to show that the employees who have more stress placed on them tend to have more errors and have less motivation to take good care of patients. And it's the same thing in any other workplace. And Zena, you mentioned it, we look for high productivity. We look for the bottom line. However, if we don't place an emphasis on the care of our employees, that work isn't going to get done. Heavy workloads, long working hours, low morale in the workplace are causes for stress, and also the effect on how we take care of patients and how we take care of customers and how we make products. Next slide, please. And I would be remiss if I didn't mention this. I know we're supposed to be talking about well-being, but there is no well-being if an employee who now feels stressed begins to use drugs and alcohol, which do have an impact in the workplace. And interestingly, that illicit drug use used to be higher among unemployed persons, and it's now more the opposite, that employed individuals are more likely to be drug users. And the answer is because they need money to support their habit. So of the 20.2 million current illicit drug users, and this is through substance abuse and mental health data, 18 or older, 13.3 million were employed either full or part-time. Next slide, please. And what keeps me up at night, in addition to drug use, anxiety and depression? They're associated with impaired work performance and safety. And if you know, there was an article in the Journal of Occupational Environmental Medicine that 47.3% and 42.9% of workers reported some degree of impaired job performance in completing work and avoiding distraction, respectively. Major depression was the strongest factor. So keep that in mind as we move forward in our discussion. Next slide, please. Mental illness and substance use disorders in America. I know we have two other great speakers on this, but you know, look at 3 in 8 of individuals struggled with illicit drugs. 3 in 4 struggled with alcohol use, and 1 in 8 struggled with both. I have to tell you that from my own little world at DH in the past year, I have had to evaluate employees who have had either drug abuse, alcohol abuse, both, major depression, inability to work, and get help for them in order for them to recover and again get back into the workforce. So 47.6 million people aged 18 or older had a mental illness. So we can't ignore these statistics, okay? These are the facts. This is the truth. Employers need to understand this. Next slide. So 10 jobs with a high rate of substance abuse. Construction workers and doctors and nurses are number 2. Keep that in mind. But look at the other areas where there are areas of high rate of substance abuse. Next slide. So the impact on the workplace. Drug abuse and addiction cost American companies $81 billion every year. Of the $81 billion spent per year on drug abuse, researchers estimate that it is spent on absenteeism, healthcare costs, and lost productivity. So getting back to Zena's statement, we look at for productivity, we're looking for the bottom line. Look at how much money you as an employer are spending because of the stress placed upon employees. And I'm not saying that employers cause people to use drugs. There has to be a pre-existing genetic or environmental condition which places this initiative to do drugs. 80% of drug users support their drug use stealing from work. And $25 billion is lost due to healthcare costs per year. What does high functioning mean? It means that people are functioning, however, they tend to have a lot of medical illnesses that cause them to go to the doctors, the emergency room, and look at injuries in the workplace. 16% of emergency room patients injured at work have alcohol in their system. So people are also drinking at work. Next slide, please. So hurt me with the truth, but don't comfort me with a lie. Absenteeism, 2 to 3 times higher for drug and alcohol users than for other employees. Chemical dependence, claim more sick time. 20 to 25% of accidents at work involve intoxicated people injuring themselves and innocent victims. On the job, supplies of drugs and alcohol account for 15 to 30% of all accidents at work. Next slide. So this is the progression of addiction, okay? Use of a substance to relieve tension, increased tolerance, memory blackouts. You go down, and what happens at the end? Termination from job. True story, I interviewed a young person last week who is being rehired. This person was terminated about a year ago due to her poor absenteeism. It was never identified in the work that she had a substance abuse problem. And it turned out that she was terminated because of absenteeism. And I asked her, what was your absenteeism? And the fact was that she had been using heroin and other substances. Not in the workplace. Nobody ever told her, identified that she was impaired at work. I don't know. However, she was terminated, and I said to her, well, what was the wake-up call for you? She said, well, I lost my job. I had no income. I had no health insurance. And good for this young lady. She picked herself up, and she got herself into a program, and and has been drug alcohol free for 2 years and is ready to re-enter the workplace. Kudos to people who can do that and have support. Next slide. So depression, we're not alone, okay? Many of us struggle with this throughout our lives. There's a genetic predisposition. There is other chemical imbalances that contribute to it. Most of the times it goes unnoticed, and individuals go through life just surfacing and getting through it until they're identified in some way or another. Next slide. And this is the slide that I really want to bring to life. We have got to stop the stigma. Okay, you can't just turn depression off. If you remember from Moonstruck, not Meryl Streep, but the mother slaps her and says, "Just snap out of it." Okay, that doesn't happen. Okay, and there was an article that discussed the mental health stigma and well-being among commercial construction workers, that it was discovered that stigma poses a barrier to addressing mental health among workers. Construction workers want to appear strong and continue to be strong, and any indication that they are not doing well is a sign of weakness. We have got to stop that. Next slide. So when you're worried about a colleague, what do? You know, the Homeland Security used to say, if you see something, say something. And the motto should be beyond Homeland Security. It should be that if you feel that someone at work is not doing well, find a kind way to discuss what your concerns are about that person. And 1 in 5 Americans experiences mental health in any given year. And because most conditions are moderate and can be treated effectively, people who are afflicted still go to the office. And that's what I was saying in the previous slide. They still go on to work. And some day can be more difficult than others. Next slide. So there was a public health summit, and this was discussed in the Journal of Occupational Environmental Medicine in 2018, that there needs to be a scientific and humanistic rationale for better addressing the often neglected topic of mental health in the workplace. In addition to underscoring the problem of mental health, is emphasized that there needs to be a healthy company culture. Build a culture of health at the workplace to protect and promote health and safety. Establish a culture of health and well-being at work that creates an environment where employees feel valued, supported, and stimulated to perform at their best in work they find meaningful. Next slide, please. Anxiety, another piece that goes with stress, with depression. So the mnemonic for stress is someone trying to repair every situation solo. We all have normal emotions. Feeling stress is normal. We should feel some stress. If we don't feel any stress, then we're not feeling. I feel stressed when I give a presentation. I'm only having any give it. Okay, anxiety, tension, nervous, anger, worry, those are all normal. It's how we control them that counts. And sometimes our coworkers need help on how to control these normal emotions. Next slide. Musculoskeletal complaints. I mentioned to you before about missed days from work. Musculoskeletal disorders represent an economic burden for employers. Backache, neck ache, shoulder problem. People take off from work. And usually, in most cases, there's no physical finding to support the way they are feeling. Next slide. Burnout in the United States. I am a graduate with my MPH from the Medical College of Wisconsin, and this physician wrote this article on burnout in the United States. And it's not just for physicians. Next slide. Do a Google search, okay? Teachers, pastors, service workers, such as social workers, are at risk of burnout. Next slide. And what is burnout? Emotional exhaustion, depersonalization, and a diminished sense of personal accomplishments. You may be a person that has accomplished much in life, but you don't feel that way. You no longer feel that you are an important contributor to the work that you do. Emotional exhaustion is terrible. And how can it be measured? We used to have the Mayo Clinic Wellbeing Index, and we are switching to a different product. But there's also the Maslach Burnout Inventory, and many companies pay a fee to this organization to do statistical information. It is not a good measurement of how you are going to deal with the issues in the workplace. It's more of a pulse on how the employees are feeling. It's really made for the employees to see their score and say, okay, maybe I need some help with this. It's really not for the organization. Next slide, please. So what does burnout look like? So burnout is a systemic problem. And I have mentioned this several times here at DH. It's not a problem of the individuals. It's how the individual responds to the systemic issues that are placed upon them. So we can't just as an employer say, oh, they've got burnout. They need to go take care of themselves. No, there is a responsibility on the employer side. Next slide. And the question is it the same as depression and moral injury? And the answer is no. If you look at the next slide, there's a fine line that divides them. And so moral injury is a psychological, biological, spiritual, behavioral, and social impact of perpetuating, failing to prevent, or bearing witness to acts that transgress deeply held moral beliefs and expectations. So when an employer places upon an employee a job to do, and they feel that it is creating an inner feeling of moral, what's the word I'm using? Moral distress, then there's a moral injury. If you keep doing it because you have to, because you get paid to do it, you become depressed. If there is a genetic predisposition, emotionally exhausted, diminished sense of accomplishment, again, moral injury, burnout, they kind of are on the same spectrum. There's that depersonalization again, and then lifestyle and environment. And so how do you use your lifestyle to have an impact on the experiences that you have at work and in the environment? Next slide, please. Symptoms of burnout. Okay, take a self-portrait. Look at these symptoms, okay? They can be with a lot of other diseases. However, you need to take a deep look into yourself and self-reflect. The house cynic becomes very critical of anything that's occurring in the workplace. How many of you have experienced sleeplessness? Okay. Emotional intelligence, difficult to hold in feelings. Next slide. So what are our next steps? Depression, anxiety, burnout, moral injury, and prevention. There is that personal responsibility, and then there are the employer obligations. Next slide. So I'm going to start off with something that I became very in tune to when I was at UMass, and that was mindfulness. Not for everyone. However, if you ever get the opportunity, it's now free. There's a documentary called The Connection, Your Mind and Your Body. And it takes you through the lives of several individuals who were somewhat skeptical of mindfulness and who had a life-changing events to their lifestyle. And it all started with a journalist who was told that she had a physical ailment that was going to put her in a wheelchair by the age of 80. I'm sorry, by the age of 30. 80 might happen. And she didn't believe it. And she went out seeking people who have had chronic diseases and how they dealt with it. Next slide. There's also a book and also a podcast called 10% Happier, something that I listen to on my many travels since I don't always stay here in Lebanon. Very, very great, good podcasts. And there are also is an app to talk about ways in which you can develop mindful skills. Next slide. Next slide. Okay, so this is the benefits plan. Okay, again, it's a line by line. I think you're going to get a copy of the slides. These are things that employers should look at to help their employees and look at the benefits package to be more focused on the well-being of employees. Next slide. So DH has implemented many of these programs, and we are working on improved behavior health initiatives. And next slide. I'm happy to announce that we had a program here called Live Well, Work Well. And it was here when I started. It's been in existence at Dartmouth Health for about 15, 20 years. And it was time to sunset Live Well, Work Well, and focus more on our employees' well-being. So I was influential in getting the Office of Employee Wellbeing started. And it really basically was a reshuffling of many of the things that we offer to employees. So it starts with organizational well-being. If it doesn't start at the top, where our leaders are encouraging employees, even other leaders, to take out time for themselves, then we can't have a program. Is the organization going to be receptive to when a Press Ganey survey comes out that says, hey, you're not doing well with supporting us? We have the long-term existing employee assistance program. Again, getting a place on its own rather than being a part of a Live Well, Work Well program. And then we have the Caregiver Wellbeing Council. I also started that when I came here, and it has grown, and it has as the chairperson a member of the Board of Governors, which is a leadership physician group, and to help influence and bring about changes that the Wellbeing Council, the Caregiver Wellbeing Council, focuses on. And then we have lifestyle management. We have apps which it's called Manage Well. Employees can get involved with competitions. We have nutritional counseling. We have exercise programs, and we have counseling for lifestyle changes by professionals in the area. Again, none of this is forced on employees. However, it becomes available, and it has to be part of the culture here. Next slide. For the Wellbeing Council, again, we started with pillars of strength: the culture of wellness, the efficiency of practice, the personal resilience, and when COVID came about, COVID well-being. Again, there's a lot of stuff here, and it takes time to accomplish many of these things. And I am proud to say that with the current culture of being careful of the budget, is that we did a lot of this with grassroots initiatives and with folks that were very engaged in trying to bring this to their colleagues. So employee well-being is the foundation for safe, high-quality patient care. This is our house. Next slide. And the resources for healthcare workers' well-being, there are 6 essential elements. And I did get this from the National Academy of Medicine, that if you don't advance organizational commitment, strengthen leadership behaviors, conduct workplace assessments, examine policies and practices, Are they all punitive? Where do you get involvement from employees? Do you enhance workplace efficiency? Do you cultivate a culture of connection and support? COVID has been had a great impact on our culture of connection. As we're doing today, connection through webinars gets old, and we need to be more creative on how we connect with other people. Next slide. And this is our again a way of showing what we do. We want to cultivate the physical, the mental, and the social well-being of our employees. Next slide. I would be remiss if I didn't mention gratitude. And there have been, I just feel that it makes a big difference. And one of the things that I started during COVID on many of the meetings that I have attended, and I look at people's faces and I can see the stress. And what I started to do is at either the beginning or the end of the meeting say, I'm really grateful to so-and-so for doing this. It came from the heart. It wasn't just, saying it. And I'm grateful to this. I'm grateful for this because scientific studies show that you actually feel better by being grateful for someone else. And it started to work that other leaders took it upon themselves to do it during their meeting. And I no longer had to do much of the leading of this. And then there's the resilience. I know it's a word that's overused, and it's important for us not to go back to where we were. That's not resilience. Resilience is accepting the changes that have occurred and moving forward. Okay, we can't say to anyone, you need to go back to the way you were before. No, that's not what we're looking for. And option B is another book, lifestyle book that I happened to read by Sheryl Sandberg, who had, she worked for a big company, but she too experienced the death of her husband, which was very quick, and how she got all these benefits as being a high-level person and said, hey, what about the people that are working on the front lines? They may need more than just 3 days to have a bereavement. What can we do for those folks? So again, we need to be more creative in how we work with our employees who are going through lifestyle changes, and being grateful to those employees is very important. Next slide. So I belong to the American College of Occupational Environmental Medicine, and I love to put this up because we create a true culture of health by involving the workplace, where employees spend a good part of their time, the community, where we have to look at the public health and the patients and their families, and we need to have primary care, which is in the home. So workplace, community, and home are very important for sustaining a well-being in our employees.
Susan Stearns, Executive Director of NAMI, New Hampshire, the National Alliance on Mental Illness. She has worked in the nonprofit sector in New Hampshire for over 30 years, advocating for families, children, and individuals with disabilities. Her personal experience advocating for loved ones in both the child and adult mental health systems drives her passion for transforming New Hampshire's system of care in order to improve the lives of all Granite Staters affected by mental illness and suicide. Susan does this work because no mother's child should have to fear seeking help for a medical condition because of stigma. She's a member of the Governor's Commission on Disability, the Governor's Advisory Commission on Mental Illness and the Correction System, the Commission to study the incidence of post-traumatic stress disorder in first responders, and many other commissions and boards. You can see the detailed bios. Again, we shared the link to our speakers' bios. I'll give it over to Susan.
I'm going to share my screen as well. I'm going to try not to be duplicative for anything that Dr. Adamo shared, but there we go. I think you should be able to see that.
Yes.
So as Ina said, that I am the executive director of NAMI New Hampshire. We're a grassroots organization working to improve the lives of all people affected by mental illness and suicide through support, education, advocacy. And indeed, I come to this work really with my credential as MOM, a mom, and someone who has had loved ones since I was very young who were impacted by pretty serious mental illness. So here at NAMI New Hampshire, we rely upon over 200 volunteers across the state to help us provide these services, support, education. Those are all folks with this lived experience, either they themselves living with mental health disorders, or their family members or someone who loves someone with a mental health disorder. So just a little bit of framing here in terms of the trends that we're seeing, because the thing that we hear all the time at NAMI New Hampshire is the impact of COVID. As Dr. Adamo said, pre-COVID, we were looking at numbers of 1 in 5 US adults experiencing mental illness. There are some surveys now indicating that as many as 4 in 10 adults are now reporting symptoms of depression and anxiety. Kaiser Family Foundation just issued a new survey they did with CNN, some great information there. This is from a previous one, where we can see back in 2019, we were talking about anxiety disorder and or depressive disorder being at this 11%. It surged up by January of 2021, still pretty high in March of this year. I think all of us are not surprised to hear this. This is the most recent data that Kaiser Family Foundation and CNN came up with, and I think is really important for all of us. This pandemic appears to, it's impacted us all. I don't think any of us have been immune to the pandemic, as well as the other things happening in our society and other issues such as climate change. But our young people are really reporting significantly greater increase in issues of anxiety and depression and their mental and emotional well-being being poor. Here in New Hampshire, one of the most visible signs that we have of the issues that our system has faced is a phenomenon called emergency department boarding, where people who are experiencing a psychiatric crisis requiring the level of care that an inpatient stay would provide, that there isn't a bed immediately available, and they have to board what we call in emergency department boarding or ED boarding. They board in emergency departments. And one of the phenomena that we see, so NAMI New Hampshire has been tracking this data since 2015. What's really striking, the dark blue line are children who are boarding. And so all of a sudden, and it was actually in August of 2020, the numbers shot up in terms of kids boarding. They've come down a little bit a few times, but we're still up here. I think we had 20 kids boarding as of yesterday afternoon, and over 30 adults. So this is the most visible sign of our mental health system that is really being stressed beyond. We had a mental health crisis before COVID. It's only been exacerbated. Some recent data, and this is not that recent data, has indicated that after a 2-year decline in suicide rates, that we have seen an uptick in 2021. Here in New Hampshire, this has been pretty consistent for a number of years now, which is that suicide, this green boxes, is the leading cause of death for those between the ages of 10 and 34. The blue boxes include the overdose deaths. So we know that those are significant issues. That's not just overdose death, but they're included in the unintentional injury category. So within the past year, the American Psychological Association, the American Academy of Pediatrics, and the US Surgeon General have all declared that our youth are facing a mental health emergency. Again, this is not something new, but something that has indeed gotten significantly more critical. This is very recent survey that was done, showing that about half of all parents say that the pandemic has had a negative impact on their child's mental health. I'm guessing most of you probably employ folks who are parents. Interestingly, school teachers and school personnel think it's higher. So a CVS Health survey recently found that school personnel were more concerned even about kids' mental health than their parents were. Here in New Hampshire, NAMI New Hampshire provides a service through the state's wraparound or fast forward program, which provides wraparound services for children and families. These are kids who are experiencing what's called a serious emotional disorder. Very striking, in February of 2020, we were supporting 175 families. And today we are at over 450 families that we are supporting. So, and those numbers continue to stay consistently really high. So there's no question that we are seeing a significant impact upon kids and families in our state. Also, you know, when we think about things like presenteeism in the workplace, the impact of a mental health crisis in the family has a huge impact on your workforce, even if it's not the employee. So that's just something to be mindful of. When I showed you those folks who are boarding in emergency departments, imagine if that's your loved one, the toll that takes, and if it's your child, there's a whole nother host of complications in terms of how that affects you and your ability to function and your ability to be present at your place of employment. I'm just going to skip that. I think this other interesting piece of data was that folks see, no surprise, actually, long time people have really felt that families play a really critical role in responding to some mental health crises. Interestingly, I thought was the fact that in this study, and I've got it circled here, how many people actually thought, 44% thought employers should play a major role, 46% a minor role, and only 10% felt employers shouldn't play any role. So I think it really speaks to how we as employers need to be able to respond to our employees' needs and when they or their loved one is experiencing a mental health crisis or disorder. No surprise, I don't think, I say that because I do this all the time, so maybe it's a surprise to some folks, but that folks who are struggling to access care, the cost of mental health care is significant. And also health insurance companies not covering mental health services like they do physical health. The reality is that there the law says there should be parity between the coverage that health insurance carriers provide for physical health versus behavioral health. However, that has yet to truly become reality for most people and most plans. And we frequently hear from folks who have health insurance. They call that number in the back of their card. The behavioral health provider of their health insurance plan gives them a list of providers, and they go through them all and they cannot find anyone who's taking patients. Sometimes they find folks who are no longer practicing are still on the list. So I think it's really important for us as employers to be mindful that we want to make sure that our employees are getting a chance to access those services. And I certainly know as an employer that is next to our employees' salaries, the biggest expense that we have here at NAMI New Hampshire. So it's beholden on me and our senior management to try and make sure that indeed our employees can access the full array of services that we are trying to ensure they have access to. Another phenomenon we're seeing, though, is providers no longer taking insurance. I've had this happen with a family member myself. Provider they've been seeing for over a decade has stopped taking any sort of insurance and has to be paid on the spot. So just to tell you, if you're hearing of these things from your employees, they're not uncommon. And then that big one, stigma, continues to be huge in impacting people's ability to access treatment. So I'm giving you a lot of sort of, shall we say, sobering information. I do want to say that we do see some systems transformation happening here in New Hampshire, as well as across the country. But here in New Hampshire, on January 1st of this year, the state launched the New Hampshire Rapid Response. And we're going to provide you, I know, these slides and this information to access this is going to be in the chat. Rapid response provides a single phone number, this 833-710-6477 number at the bottom of the screen here, where someone can call if they or a loved one or a coworker is experiencing a mental health crisis, or if you're wondering, is this a mental health crisis? They're able to do an assessment over the phone. And even now we have statewide mobile crisis teams. So they can even deploy a mobile crisis team to wherever the person is in the community. This is truly a transformational shift in our community mental health system. This is the data through July. I have heard anecdotally that they are now in September had over 20,000 contacts. So this is since January 1st. In addition to mobile crisis deployment, if someone perhaps doesn't need that level of care, but maybe needs to see someone the next day or so, they can make a crisis stabilization appointment. I do caution people that is not the initial evaluation one might have at a community mental health center to be accepted into care. Indeed, our mental health centers tend to have longer waits for that, but in terms of someone needing that crisis stabilization, that is available. It is possible that rapid response will make an assessment that someone should still go to an emergency department, but these now have options besides that we did not have across the state in New Hampshire. So this has really been a real addition to our system that really has made a difference for a number of people. In July of this year, federally, what was the National Suicide Prevention Lifeline converted to a 3-digit number, 988, which is a fabulous resource. They do not yet have geolocation for 988. So that's why I still encourage people to use this 833-710-6477 number, because if you don't have a 603 area code and you call 988, your call will be answered by the call center that covers that area code, which then will not be able to, for example, to deploy mobile crisis or make that crisis stabilization appointment for you in New Hampshire. So 988 is a fabulous resource. Just if you don't have a 603 area code in New Hampshire, I would go with the 833 number that's here on the screen so you can access the full array of services. This has, as I said, been transformational. Now when someone has a mental health crisis, they get a mental health response as opposed to a law enforcement response, which is what would happen when you called 911 before. So here at NAMI New Hampshire, we offer support groups that are led by our trained volunteers. These are people with lived experience. We up here on the screen that you can see different types that we have. I won't go through them all in the interest of time. I want Todd to have a chance to speak. But we do, one of the silver linings of COVID is most of these are available, actually all of them are available via Zoom. We do have some that are meeting sort of every other week. They meet in person, sort of a hybrid model, but we have seen increased access to our support groups. We also have several Facebook support groups, which are closed groups, and great resource if someone really needs to get connected with some support. They truly do act like support. They are moderated by our staff, and there's no selling or anything like that, and you have to pass sort of a screening in order to be able to join it, but we can do that pretty quickly, so that's pretty quick support. We also are able, through our information and resource line, to provide just that, information and resources, as well as some one-on-one support for folks who are struggling or have family members who are struggling. We do offer supports for veteran service members and their families. Want to also mention that the VA mental health apps, and the link is here, those are free, and they have some fabulous mental health apps that are great even for folks who are not, tied to the military or and they are free for anyone to access online. So always encourage folks to check those out. Our education programs, several of them are run by trained volunteers who are, again, people with lived experience. Our Connect Suicide Prevention program is not led by volunteers, but is a nationally recognized best practice. And then we also do crisis intervention team program training for law enforcement and other first responders. One of the real key things with mental health challenges is to connect early. This is an endeavor we have going actually with Dartmouth, UNH, IOD, and the Institute of Disability at UNH, and also the Children's Bureau of Mental Health Services. So really trying to get folks connected early, we know it makes a difference. As I said, we do a lot of advocacy here, including training people on how to tell their stories and try and move policy forward. So happy to provide information. We also have some speakers bureaus, which are truly life-changing for folks. Sometimes when they hear our trained speakers, these are folks with lived experience. We have a number of employers who in the state who have our speakers come and now via Zoom, sort of for a lunch and learn kind of thing, and have found that's really been helpful. More of our anti-stigma work. And then I think Dr. Adamo talked a lot about ways to support employees. I cannot emphasize enough challenging the stigma and making it a place where folks can talk about their challenges and when their families are struggling. And truly, if someone is navigating the system, it is enormously time consuming and often has to be done during sort of the 9 to 5 hours. So trying to be flexible for that. And similarly, it can be very hard to get an appointment, making a place where someone could have a telehealth visit because basically if you can get an appointment, you don't want to miss it. And all those wellness things, we know they actually do improve people's mental health. So please, continue to encourage that, because folks may be waiting a long time to get appointments, but all of those practices can really improve their mental health. And we've had some employers who, this is a rack card, it's two-sided, who have made these available to their employees. Happy to talk to folks about that. We have a number of other resources I'm going through just to get to our final crisis resources. There we go. So obviously that rapid response access point, 988, are important resources. The crisis text line is still functional, although both 988 and rapid response do have texting function now. And then for our LGBTQ plus youth, the Trevor Project is an incredible resource. So would definitely encourage folks to check that out.
Thank you, Susan. I want to give Todd a chance to give us a case study of something that they've done and a brief introduction. Todd Buffum is a regional manager at Impact Fire Services. He's also a former U.S. Marine and has over 35 years operating, leading, and managing teams experience in the fire and life industry. He is known for his conscious leadership that places value on emotional intelligence, personal growth initiatives, and incorporating community service into the workplace. I have his extensive bio in the link, but I want to give him the chance to talk about their initiatives as well.
I appreciate the opportunity. Impact Fire is a life and fire safety service company. We have 30 locations across the United States, with our largest one being right in Hudson, New Hampshire, with about 150 employees. And I was really excited to talk today because we really have intentionally brought mental health normalcy into our work, into corporate America, if you will. And we really treat it with as much as we do our physical safety. In our work, we're in the construction business, in the service business. We're required to meet OSHA standards for safety, and we've piggybacked our mental health program onto our safety program. So every month, every district office across the country is required their managers get together with their people and have a toolbox talks. Generally, it's 20 to 45 minutes. And they'll talk about ladder safety or defensive driving or working from heights. But we also piggyback a mental health topic. Just to give you an example, and I'm so proud of our evolution and our journey. I was in a district office just on Friday, and the way we started our meeting was a guided meditation to ground the team. And then for about a 15-minute guided meditation with the entire team. And then we went into our modules And the module this month was around anxiety and stress. And we hired a clinical psychologist that did a brief 15 or 20-minute video for us that we were able to share with the entire team, and then have discussions around it. And it was so powerful because number one, I think it was because of, we were grounding and meditating and then taking in the content, and then, people really were real in the room and sharing their experiences and sharing what's going on with their depression, their anxiety, and what might be triggering it. And there were a lot of great tools that were introduced. It's just a different type of meeting now. Now, that's not happening in all of our offices across the country, but that's our goal, is that we can normalize these mental health issues and topics and talk about them, and talk about that human experience and that human journey and the feeling states. And that's what you'll see in an Impact Fire office. We also, this time last year, we rolled out a mental health program around addiction just before the holidays. As I said, we were in the construction market industry. And as the doctor had mentioned, the depression in the construction industry is higher than all the others, right? And we're seeing the suicide rate in our industry 2 times higher than the next industry below us. So there are a lot of warning flags and red flags out there, and we have to, as a company, be very proactive in bringing resources and tools to our people into the human family. And we do that by a lot of different ways. Some of it is through our healthcare that we do provide, where there is that portfolio of assistance and help, but we do a lot of things internally as well. And it's things like having these toolbox talks that we do on a regular basis. It's training our leaders and our supervisors, because I believe all of this, to get rid of that stigma, really starts at the leadership level. We need to make sure we're visible and supportive of this, and also have to model it. Right. I think the doctor even mentioned that. I mean, I think that's important for us to be a part of this journey as well and take care of ourselves. But our managers also have to be aware and be proactive when they see things on their teams, and then really with our employees to make sure, that we're training them on the awarenesses if they're having certain thoughts or why they're feeling a certain way, and then be able to guide them to all of the resources and support that are available. It's a real team effort, but that's what I love about it. We're in this together. And we've I believe here at Impact Fire, I'm really proud that I think we're an example for others to follow in the business world. And that's one of just many of the different things that we are doing here at Impact Fire on a regular basis. And it was great in that meeting on Friday to hear people talk about how they know somebody that's struggling, or they're struggling, or they've had somebody that's taken their own life or attempted to take their life, and how do we deal with it, and what this is all bringing up. And there were tears in the room, and I think when you can get to that level and be real with it, that's when you can make the most change. I know that was a quick 6 minutes. I have so much else I'd like to share, because there's a lot of great things, but I'm really grateful that we're talking about it today, and we need to keep this conversation going forward.
Thank you, Todd. And I promise we'll allow you a better
pinky swear, because I'm going to take you up on that.
So I have one question in from Rebecca, and she's working on a resilience project for children, adolescents, and elderly people in the region, and she needs survey tools or scales for pre and post program participants. If someone is willing to type survey tools or provide resources, I'm assuming Susan or Dr. Adamo is the resource for that, survey tools and assessments for that. If we can't get to the question, Rebecca, I'll follow up in the email. But I want to, does anyone have survey tools available right away, or?
I know of a physician who is doing a project for improving well-being of a certain group of physicians, and they're using the Maslow inventory at pre and post, to measure to see if people are feeling better. I don't know how much it costs. I have no investment in it, but the Maslock, MASLOCK inventory may be of help.
Yeah. Okay, so I will follow up with that as well. Thank you all. I don't want to take any more of your precious time. Thank you all for doing this and for bringing light, shedding light on this topic. I want to make sure that everybody here is aware that we offer multiple resources, and some of the resources that NAMI's presentation had shown are available on our resource page. We also offer, similar to what Todd mentioned, mindfulness sessions and stress management sessions during Refill the Well. So you could see the full offerings of this program. Many of it is available for free and online, in addition to our partners offering webinars like Dartmouth Health, and we provide links to those as well. So you have a wealth of information on the website. Thank you all for attending, and we will be following up with recording and resources.